And now the main issues of their health become diseases of civilization. What the hell is a disease of civilization? It's what they was used to be referred to as Western diseases, diseases of the West, because only Western countries got them. They're post-agricultural diseases. They're diseases from eating the wrong food and getting poisoned and sick. And so it's diabetes, it's heart disease, it's cancer, it's autoimmunity, it's dementia, Alzheimer's, and all the rest. And so this is completely preventable. And we see this cause and effect relationship, not just in yourself, but in entire populations. We saw the Native Americans didn't have any of these sorts of problems largely before the bison were wiped out, especially in the Great Plains where they were largely carnivores. And then when we did wipe out the bison, all of a sudden they had to switch to a post-agricultural way of eating. Now they have 4 times the chronic disease rates that we have. And at the late 1800s, their average height shrank by several inches. There's a study called The Tallest in the World. It was published in 2001. And it looked at original source data. People had gone out in the late 1800s and measured the average heights of everybody around. They found that the Plains Indians, and especially like the Cheyenne, things like that, were by far the tallest human beings alive on Earth at the time. They were
Wow.
well taller than the European Americans at the time. And so their average height at that time for adult males was 5'10". Right now it's 5'8" in America. Not everybody knows that. They think it's much taller than that. It's 5'8". They were 5'10" at the end of the 1800s. And you have other populations, maybe in like Denmark, they eat a lot of meat, they eat a lot of dairy, and they tend to be slightly higher. The Maasai are like average 6'3". They're just carnivores. Their
Oh,
neighbors,
wow.
the Akikuyu, who are more largely vegetarian,
Yeah.
average height 5 inches shorter than the Maasai, even though they
Wow.
interbreed with genetically similar populations. So that's all development. That's not genetic. And so we saw this in the Native Americans in the late 1800s, that they were the tallest human beings alive on Earth at the time, right? But this was the really important part here, was that this was just after they'd been put on the reservations and all the bison had been wiped out. So that this was just at that transition point. And so what they noticed, and they documented this at the time in the 1800s, that the young adult males were by far the shortest in the whole tribe, and their fathers were taller than them, and
Oh,
their
from the dietary change.
them
Yeah.
exactly
Wow.
because the dietary change happened right then. And so you saw this in real time. You saw them shrinking down over time. And then the chronic disease started going crazy. Weston A. Price, Dr. Price, a dentist, wrote a whole book on this, big, thick book. And he went from population to population, all these different native populations. And he saw as they were changing in the early 1900s, he saw their height, health, and he was specifically a dentist, so he was looking at teeth that had fallen arches, they were small, had smaller jaw size and worse facial development. And he saw this, you could actually reverse this. You see it in families. Like this part of the family, they're eating more traditional, and this one kid is eating more of the Western food. And that was the one that was having developmental problems. Start adding in, and he theorized that they were missing some vitamins in animal fat. And that's exactly what it was, at least for the jaw development, because that's in current dentistry journals right now today. That you need that crooked teeth and small jaws is not genetic. It is developmental. It is nutritional. It is generally, well, you need K1, K2, D3, calcium. And if you don't have enough of those, you can't develop your face, your jaws and teeth properly. And also you need to chew harder food than just smushy peas. When you give these kids just mush crap, they need to chew and they need to work their jaw. That stimulates the hard palate to grow and develop properly. But you need those nutrients. And K2 and D3 only exist nutritionally in meat and animal fat. And it's typically people are most commonly deficient on the K2 side of things. And that's where they get this deficient jaw development and crooked teeth. And so
Wow.
Price actually, so we started reintroducing raw milk and butter and animal food, meat and fat, that he was actually able to reverse this, and their jaws all of a sudden started growing, their teeth started straightening out themselves, and those sorts of things.